All right. So this is Sylvia. She is a 34-year-old white bisexual woman. She is from the Philadelphia area.
Freedom.
Born and raised. She grew up in foster care. And she currently is dealing with depression. She has attempted suicide 8 times, and she's been in some partial hospitalization, and now she is receiving some one-on-one therapy with me. So that's the background. For the first time. For the first time, she's doing therapy, and this is the fifth session.
It's the fifth session.
Fifth session.
Mm-hmm.
All right, so we'll get right into it.
All right.
Hey, Sylvia.
Hey.
So how are you doing today?
I feel okay. I haven't wanted to throw myself in front of a bus yet today, so that's progress.
Mm-hmm. Progress. Maybe a little bit about what progress means to you, what that looks like.
I just feel less like I'm gonna hurt myself.
Okay.
So yeah, that's been my progress from the last week. Like a little bit less. It's getting better.
Okay, it's getting better. Yeah. So what has been going on, I guess, for you, just internally or emotionally this past week that has shown you some progress?
Mm-hmm. Well, we talked about earlier. We talked about taking our emotions and just thinking them through. So whenever I feel like I'm gonna hurt myself, I think through it. Think through the entire event. And then I'm like, oh, I'm gonna upset everybody around me, but also I don't actually want to hurt myself right now.
Sure. So you're taking into account the other people in your life and how you don't want to hurt them.
Yeah.
Because if you hurt yourself,
it will hurt them, or at least the people that it would hurt, if they found me or whatever.
Sure. Tell me a little bit about what that emotion is, or what those emotions are behind that. Is it more so just sadness? Is it does it bring up anxiety to think about?
Hurting other people? Yeah. Anxiety. And I'm scared of hurting the people in my life, even though I'm not scared of hurting myself. So maybe that's progress just because it's stopping me, and it's never stopped me before.
Interesting. Yeah. So that's been a part of just the process of not wanting to hurt yourself, is taking a moment to think about those people that you would be hurting.
Yeah.
So that's a newer development. Wow. Yeah. I'm curious, who are some of those people that kind of come up into your mind when maybe you are thinking about harming yourself? Who are those people for you?
Yeah, well, my friends and my tennis coach. Yeah, he would be pretty upset. I walk dogs sometimes with this woman. It's just random people, but also contextually, I was on the subway platform, and I considered about throwing myself in front of it, but I was yeah, that would cut so many people's commutes. It would increase everybody's time in the subway, and it would be terrible and traumatizing for everyone to watch. So I was I probably shouldn't do that. And I never thought that way before. So.
Wow. So it's there's been this shift, it sounds like.
Yeah.
So thinking about kind of the broader context or the bigger picture, this would really affect other people, around, people close to you, but also just kind of random people on the subway, what that would mean.
Exactly. And when I was younger, I was just they're better off. I might as well just hurt myself. And now it's been a shift.
Wow. Yeah. Wow. Definitely. Has anything else come up for you this past week? As far as have there been incidences when you have felt or that have triggered maybe feelings of wanting to hurt yourself? Have there been certain things that have come up for you?
Well, I think I like hurting myself. I think it's just part of who I am, and I do it in different ways. even though I don't want to kill myself, I'm still like having sex with random guys. And I think, yeah. And one time this past week when that was happening, I was just like, damn, I like want to hurt myself, but I was hurting myself. So it's like this like whole thing. I don't know how to explain it.
So like when you were having sex with these people, you were feeling like you wanted to hurt yourself, like in those moments, or was
Yeah.
Okay.
Yeah.
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 Should probably stop.
Should probably stop.
Probably stop.
I'm curious what makes you want to stop, or like what tells you to.
I think that I don't want to feel like I want to hurt myself anymore. And it's been like a comforting thing the past like 15 my life, the past my life, but now I'm like I don't want to feel that way anymore. Yeah.
So you are noticing that shift once again of like, because you said earlier, like, okay, I like to hurt myself. I'm used to that kind of pattern, you know, of hurting myself, but you're kind of starting to enter this shift where maybe you don't want to, maybe you don't like that version of yourself.
Yeah. And like, yeah, I don't know. I think I'm starting to care about myself a little bit more. 5th session.
Sure.
Yeah.
What does that look like for you, like caring about yourself? Like day to day.
Yeah, like not wanting to hurt myself or not wanting to like have sex with people who are using me.
Sure. Yeah.
That kind of stuff. Yeah.
Yeah. So it's like self-care, like realizing that you are worth more than that. You are more deserving of that.
And I was thinking about it, and there must be a reason why I still survived after 8 suicide attempts. Like, there's a reason for that. Right. Maybe I'm just really bad at killing myself, but also maybe I'm supposed to cure cancer or something.
Well, what I see, Kelly, just in the work we've done together thus far, I see a lot of resilience. You've been through a lot in your childhood and in your adulthood, and you've been changing and growing and learning and experiencing all of these things, and you've been dealing, you know, with wanting to hurt yourself and kill yourself, but you're starting to notice a shift internally that you do want more for yourself, you know, and that you do consider not just yourself, but also like your friends and your family and your community. You know, I see a lot of resilience.
Thank you.
For sure. But yeah, I guess we will go ahead and wrap up for today. But I plan on seeing you next week, same time.
Okay, let's do it.
Sounds good. Great. So, part 3. Why did I choose this theory? Well, I think I've always been drawn to like person-centered approaches. I think just because there is like a focus on the therapeutic relationship, and like the therapeutic relationship is like the agent of change, you know, and so, you know, just involving like empathy and unconditional positive regard, I feel like that just comes, I think, naturally to me as an emerging therapist. Like that makes sense to use those techniques within the therapeutic relationship. How was the theory used in the session, and what ways did you both see the theory influencing the session? I don't know, for you, Kelly, what were there things that stood out to you? Like, because I guess with person-centered therapy, it's like there's a focus on empathy and like listening and letting the client kind of lead.
Yeah, I definitely felt that. I felt like you were very empathetic and like very kind, and you were listening without judgment, which is like very cool. It like helps build rapport between you and the client.
Yes.
Yeah, I felt very heard personally.
Great. Yeah. I'm glad. Well, there you go.
Yeah. There you go.
There you go. Yeah, because I think that's essentially person-centered. It's like the client kind of is taking the reins, so to speak, and the therapist is just there to kind of like help navigate or guide and like just like listening, summarizing, clarifying, all of that good stuff. So compare the use of this theory with another. I guess comparing this to CBT. Do you know much about like CBT?
No.
Like
What is
therapy?
it? What's the acronym?
So cognitive behavioral therapy.
I've heard of it, but I don't really know much about it.
So it's interesting. It's like widely used, but it's like more like psychoeducational, and there's more of the focus on like managing symptoms, whereas like person-centered is more like focusing on like personality change and helping the client reach like self-actualization.
Mm-hmm.
But CBT seems a little bit more like pragmatic, a little more like, I don't know, logical in its approach. And yeah, there's more, kind of more, I guess you would say, advice giving, if you will.
Mm-hmm.
But yeah, just like more psychoeducational than like person-centered, which is interesting. Were there any multicultural considerations? Well, so your client was a bisexual woman.
Ooh.
We didn't get into that, but I think as a person-centered therapist, obviously keeping that like in the context of everything. And what I do like about person-centered therapy is that it does realize the real, like, bigger systemic issues and barriers that clients face, especially when it comes to gender and sexuality. And I guess I was reading, and I guess person-centered therapy is common working with like LGBTQ clients. Mm-hmm. So because there is that realization of like bigger context and what these clients experience in their everyday lives, and the discrimination that they experience, but also just being there for like empathy and just creating open space for the client to like truly be their authentic selves.
Right.
You know. Strengths and limitations. So strengths, I think, again, focus on the therapeutic relationship,
right?
And having that warmth and empathy and creating space for the client just to be themselves and hopefully feel comfortable to be themselves. Mm-hmm. But limitations, I would say, there can be sometimes a lack of structure a little bit, and like the therapist never gives really like direct advice or suggestions, or they don't really have direct or concrete intervention, so to speak. So I could see that maybe being an issue, right, or a limitation. And the last one, how and why might you use your cat specialty, which would be music therapy. Hey. Well, I'm biased, but I think that's always appropriate to use music therapy. I don't know. I think it would be important, in building more of a stronger therapeutic relationship by doing some like music making. I think especially maybe doing like an improv. So maybe I would just like whip out the guitar, and give you like a xylophone or a drum or something. Xylophone. We would build that empathy. Maybe like I would like give you space to do like a solo on the xylophone, and I would try to reflect back on my guitar like something, or vocally, and that would be kind of like an empathetic approach, I guess, to connecting with you and building that therapeutic relationship. Yeah. So that's essentially it, folks. Any questions? Any concerns? Any comments? No. All right.
Will you be my therapist?
100%.
Amazing.
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 Signing off.
Let's play some xylophone.
Let's go.